Hi there, it's Doc Davis. Today I want to talk about the 5 most common causes of low back pain. Number 1, degenerative disc. A degenerative disc is a common cause of low back pain. Think of a degenerative disc as a shock absorber. The disc works as a structure that can absorb impact, and much like a shock absorber in your car will absorb potholes or bumps and vibrations when you go over something like a train track. So the disc in our back is vital to allowing us to jump and lift and twist and play sports or do our jobs without experiencing significant pain in the bones, the vertebrae in our spine. As we age, something that we're all trying to avoid but is inevitable, we're going to see wear and tear in our discs. And there's no need to be alarmed if you're told that you have a degenerative disc or have degenerative disc disease. It's not a disease or a problem like diabetes or high blood pressure that you're sort of watching it get worse over time. You can have degenerative discs in your back and have no symptoms. It's something a lot of times we'll see on an x-ray, but has nothing to do with a patient's problem. So there's no need to be overly concerned with a degenerative disc unless it's something that's causing you significant back pain. And that's something we can talk about. So as a disc wears out over time, it loses water and it becomes less compressive and doesn't work like a shock absorber. And then that now transmits strain that you put on your body into the vertebrae, causing back pain. Now we can't change a degenerative disc or an injury to a disc, as this is something that tends to happen over time, but we can do things to try to mitigate or offset the problems that happen when a disc wears out. Things that you can do to help in the setting of a degenerative disc in your low back are to use good spinal mechanics and not reach forward and pick things up and not stay in awkward positions, which puts a lot of strain on a disc that already isn't starting to work. One thing that's very harmful to a degenerative disc is smoking. Of course, there's several negative health impacts when you smoke, such as problems with your lungs and your heart, or even healing issues after surgery. But smoking has a direct impact on how a disc functions and ages. And if you smoke a lot, you'll cause injury to your disc, further causing the likelihood of low back pain. Typical symptoms when you have a degenerative disc are going to be pain localized to that area. So you're going to notice pain in your lower back. Typically the discs that wear out are the ones at the bottom of the spine because they have to shoulder the most stress and strain and load on our backs. So it's common to have a disc wear out in your lower back, and if it hurts, you're going to have pain in that area. Common symptoms would be pain in the middle of your lower back, but it's not uncommon to have pain that'll radiate even out into the hips and even down partway into your leg. We've identified that low back pain is one of the most common causes of injury or musculoskeletal problems in adults. Some studies will say that up to 60% of us are going to experience back pain at one point in our life. As bad as that sounds, most back pain that we'll end up experiencing is self-limited, meaning it's going to run its course and it won't be permanent or chronic, and it's not something that you're going to have to live with the rest of your life. So typically if you experience low back pain from a worn out disc or an injured disc, it will recover on its own. Again, it's something that a lot of times you don't even need to come see someone like myself for, and that you can manage on your own, making it much simpler to deal with and not becoming as big of a problem in your life. Ways to treat a degenerative low back are several. Changing what you do in the short term is important. Avoid prolonged sitting. Sitting has been shown to cause significant injury and strain on a disc. Number 2, facet injury. Facet joint pain is another common cause of lower back pain that I see. The facet joints are located in the back of the spine, just underneath the muscle, and they act like shingles, and they limit the vertebrae, the bones in your spine, from moving excessively. So this facet joint which is like a shingle, can rub or get pulled apart depending on the type of injury you have. You can also get arthritis in the facet joint, and that's from a wear and tear condition, and you'll get bone spurs that grow off of the joint, much like you'll see a bone spur in your knee or sometimes on a finger joint. And when you get a bone spur, it's kind of like having sandpaper or an irregular surface rubbing across each other. When you get that facet joint rubbing abnormally and there's spurs that are pushing on each other within that joint, it causes pain. It also can develop a cracking or popping sensation. So when you hear your back crack, if you bend in a certain position, a lot of times it's a little spur in your facet joint being rubbed over. A lot of times facet joint back pain is more commonly noticed when you bend back. So activities where you're arching your back, you'll notice pain. If you're going to reach something off of a shelf, or if you do overhead work for your job, a lot of times you can notice that that will cause pain in your back. The theme is common when it comes to treatment for low back pain, and it's the same for a facet joint. Sort of similar treatment that we use for other injuries in the back or problems can be applied to a facet joint injury. Rest and avoiding doing things that make the facet joint hurt, such as bending backwards or twisting, can help minimize pain while you're recovering. Icing the area is helpful, and anti-inflammatory medications such as Advil, ibuprofen, or Aleve. When you take anti-inflammatory medication, it's important to take it on a consistent basis. Think of it almost like a vitamin. A lot of times patients will tell me that they've tried ibuprofen to help with an injury or pain, and that it didn't work. But sometimes it's as simple as just taking the medicine the right way. It's helpful to use the medication for several days to try to get the full effect of the medicine to the injured area. I recommend that patients take anti-inflammatory medicine for 5 to 7 days continuously. If you have any stomach irritation when you're taking anti-inflammatory medication, stop it immediately, because it can cause stomach lining irritation and sometimes even ulcers. If you have any history of a stomach sensitivity or ulcers, then take Tylenol instead. Number 3, pinched nerve. Pinched nerves are typically thought to cause pain and numbness or tingling down into a leg, a term that's typically referred to as sciatica. And although this is true, pinched nerves in some people will cause significant back pain. And that's some of the difficulty when trying to determine what the cause of back pain is. Even though a nerve wouldn't be normally associated with back pain, it's something that I see quite frequently as an overlooked or missed cause of a person's lower back pain. And it makes sense that a pinched nerve could cause low back pain, because even though you feel pain in your lower back, in the muscle and on the skin, there has to be something causing the pain to that area. When you pinch a nerve and put pressure on a nerve, it's like an electrical wire that's malfunctioning. Think of a wire that is crimped or has lost its insulating cover, and then now it won't work normally. And if it doesn't work normally, you get these jumbled impulses, these little electrical signals that sort of go haywire out to the muscles in your lower back, and you can sometimes even kind of figure it out on your own. You'll feel a burning or a tingling or an electrical sensation in the muscles, and it's quite different than sometimes the pain you'll feel when you pull a muscle in your back, like when you get a muscle strain. It's not uncommon for patients to come to me when they have back pain and tell me that they think it's probably a nerve that's causing it, and most of the time they're right. And we can figure that out when we look at studies such as an MRI. What separates a pinched nerve causing back pain is a lot of times you'll get that pain when you're standing or walking. The nerves have to start to function, and nerves need blood flow to work normally. And when that nerve's pinched and doesn't have the right insulation or the right blood flow, it starts to give pain signals. And it gives pain signals out to our lower back. A pinched nerve causing low back pain more commonly will bother you when you're trying to stand and walk and asking the nerve to do something. The important thing about determining the cause of your low back pain is treatment is different depending on the cause. A pinched nerve responds differently to treatment than a muscle or a disc. When you have a pinched nerve, we can do things such as a steroid injection or steroid pills to calm down an inflamed nerve, and that in turn will make your back feel better. Number 4, muscle strain. The muscle strain is when you stretch or tear muscle fibers in the lower back. It can happen from a sporting event or even at home if you're lifting something that's heavy and you don't use good lifting mechanics. You'll develop immediate pain after an event such as this, and symptoms that you'll notice will be typically sharp stabbing pain. Sometimes your back muscles will feel tight and they can even quiver. That's what we call a spasm. The good thing is if you do develop a muscle strain, almost always this type of injury is self-limited. Most muscle strains will get better in about 1 to 3 weeks depending on the initial injury that caused the strain. Even better, if you develop a muscle strain, it's typically not something that would require being seen by a doctor. As a spine specialist, I'm certainly happy to treat patients with muscle strains, but most of the time you can treat yourself and avoid spending excess time or money coming for an evaluation for an injury such as this one. Common ways to treat a muscle strain would be using ice and anti-inflammatory medicine. It's helpful to apply ice for several minutes. Sometimes it's a little uncomfortable on the skin as things start to numb up, but once that occurs, it actually will make the muscle strain feel better. I recommend putting crushed ice in a plastic bag and wrapping it in a towel and applying it to your skin. Otherwise, if you put an ice pack directly on your skin, sometimes you can cause a frostbite type problem. Another good way to treat a muscle strain is with anti-inflammatory medicine. A medication such as Aleve or ibuprofen can work really well to help decrease swelling in the muscles and minimize pain and shorten the time of the injury. The final thing is to not overuse a strained muscle, so avoid any heavy lifting, twisting, or straining. This is kind of common sense. If you've injured your back, of course you don't want to overdo it, but really pay attention to how you use your back muscles during the time of an injury. And last but not least, number 5, arthritis. Arthritis is another cause of low back pain. Arthritis is associated with several different conditions. The most common arthritic condition that someone will develop is degenerative arthritis. And that essentially is the process of wear and tear that happens with aging and overuse. And in that setting, we'll see that discs and facet joints and even the ligaments around the spine just show wear and tear changes. It's kind of like when you have 100,000 miles on your car, things start to wear out and need to be replaced. When you have an older car, the interior starts to wear out and you see that there's cracks and creases in the dashboard or on the upholstery. Think of that as a similar process that's happening to our spine or other areas of our body that have to move and are subjected to lifting and bending and twisting strains. In addition to causing pain, you'll notice stiffness or even loss of range of motion. And again, this is a normal process that happens to a lot of us over time. Managing arthritis can be done by avoiding things that affect an arthritic spine, such as excessive bending and twisting and lifting, and then taking anti-inflammatory medication such as Tylenol, ibuprofen, or Aleve can help decrease pain that you experience with arthritis. The most important thing when you have an arthritic spine or a hip or a knee, let's say, is to stay active. As much as too much activity can cause an injury or pain, even worse is to be inactive. And there's loads of scientific studies along with just common sense experience in life that if you stay active, you feel better. So I think kind of the take-home message would be stay active, enjoy your activities that bring you satisfaction, and you can help moderate and sometimes minimize back pain significantly. Low back pain is a problem that we almost all face. Studies have shown that 60 to 80% of adults will experience low back pain at least once in their life. But you don't need to be alarmed, and you don't really need to be concerned, because almost all this back pain will go away on its own. Most back pain is self-limited. Typically in 1 to 3 weeks, a back pain episode is expected to recover. The time when you need to be concerned about low back pain that you experience is one of a few situations. If the back pain is so severe you're unable to get up and move about the house or go to work, that's something that needs to be evaluated sooner than later. Also, if your back pain is associated with neurologic symptoms such as weakness, or pain or numbness or tingling shooting down your legs, that should be evaluated by a spine specialist. Also, back pain that lasts too long at some point needs to be evaluated. If you're experiencing significant back pain for more than a month or two, it's best to be evaluated, as a lot of times there are causes of your back pain that have sometimes very simple, straightforward solutions, and that can minimize the time you have to experience pain. Well, that's a wrap for 5 causes of low back pain. I'm Doc Davis, spine specialist and orthopedic surgeon. Like and subscribe. I'll see you next time.